prepare for my allergy test. The main thing that you should do is to avoid any kind of medications that can interfere with the test. I'm Raina Bonds, a board certified allergist immunologist practicing in League City, Texas. Today I want to answer a question that we get a lot from patients calling in, which is, how do I prepare for my allergy test? Well, it's pretty simple to prepare for your allergy test. There's not much you need to do. The main thing that you should do is to avoid any kind of medications that can interfere with the test. Primarily, this is going to be antihistamines. Antihistamines are generally used for allergies, so allergy medicines like Claritin, Benadryl, Zyrtec, that sort of thing. Nasal sprays count too. Astepro is an over-the-counter nasal antihistamine. You should avoid that before your test. Allergy eye drops many times contain antihistamines, so you should avoid your over-the-counter eye drops and your prescription allergy eye drops before testing. Antihistamines can be in other medications as well. So cold medicines like NyQuil contain antihistamines. But then some things that you might not think contain antihistamines do. So you should be careful using things like over-the-counter sleep medications. Something like ZQuil, for example, that's just Benadryl in a different bottle. So you want to avoid that. Tylenol PM, Advil PM, so pain medications that are designed to help you sleep better in addition to taking care of your pain, those have Benadryl as well, so you want to watch out for that. What about things like nausea medications like Phenergan or dizziness medications? Those often contain antihistamines too. And that's the ones that are over the counter as well as prescription. So you want to watch out for those. There's some other medications as well, primarily prescription medications that can act as antihistamines. So you want to watch out for those. If you have any questions, you always want to either call your doctor's office that you're going to be testing, or look on the website. For example, our website, we keep a resource that has a list of medications that you want to avoid. And our list also tells how long you should avoid each type of medication. For the routine allergy medications like Claritin, Zyrtec, Xyzal, you want to avoid those for 5 to 7 days before your testing. Benadryl has a bit of a shorter half-life, so 3 to 5 days is fine. But there are some medications that have quite a long half-life, and you might need to avoid those for 10 days or even more. So again, it's going to be important for you to check with your doctor's office or check a resource list like the one that's on our website. Other things that you might consider avoiding would be some drops that are marketed as homeopathic. I have run into times when I wonder if there's anything else in those drops, because based on homeopathy, they shouldn't interfere with the testing, but they have. Sometimes we see people who are on anti-inflammatory herbs, natural medications or supplements that can actually interfere with the testing as well. Other than avoiding certain medications that can block the test from working completely, there's not really much else that you need to do. You don't want to apply anything on the skin in those areas, like a topical Benadryl cream or something like that. But other than that, nothing else is really going to block that test from working so well. So just remain calm, come on in and have your test and get your results quickly. Figure out what you're allergic to so you don't have to keep guessing anymore.